Anaphylaxis is a serious, life-threatening allergic reaction that can happen within seconds or minutes of exposure to an allergen such as food, insect stings, medication, or latex. Recognizing the ABC symptoms quickly and acting without delay can save a life. A. Airway. Start by checking the airway. Look for the following, as these are warning signs that the airway may be closing: a persistent cough or hoarse voice, difficulty swallowing, or swelling in the throat, tongue, or upper airway. B. Breathing. Next, assess breathing for difficulty or noisy breathing, which may indicate anaphylaxis and require immediate suspicion. Ask yourself, is the person struggling to breathe or making noisy or wheezing sounds? C. Consciousness and circulation. Finally, check how they're responding. They may feel lightheaded or faint. They may have clammy skin or become confused or unusually sleepy. In severe cases, patients may collapse or become unresponsive because of a sudden fall in blood pressure. What you need to do is lay the person flat and raise their legs to help blood flow. Do not allow them to stand or walk. If they become unconscious, place them in a recovery position. If breathing is very difficult, allow them to sit up slightly for comfort. Administer the adrenaline auto-injector immediately. Don't wait. Follow the instructions on the device. Call 999 straight away and clearly say the words anaphylaxis. If there is no improvement after 5 minutes, give a second dose of adrenaline using a second auto-injector in the other leg. Even if the symptoms improve, the person must be observed in hospital, as anaphylaxis can return or worsen later. Severe symptoms may occur with or without any skin rashes or hives, so never dismiss breathing problems, swelling, or sudden collapse as something minor. Recognize the ABC signs, act fast, give adrenaline, and call 999.